everyone. This is Dr. Indranil Dey, presently attached with CMRI Hospital and Zenith Super Specialist Hospital. Today, I'm going to be talking about a very important topic that most of the people are often facing, but they are unable to find out the reason. And even being physicians, it's becoming difficult for us to find out the reasons that why cough is becoming excessively worse, especially at night, and why even after giving and why the asthmatic symptoms are becoming worse even after prescription of the recommended asthmatic medications. As per the new guide, as per the some new researches has been made in the development of this diagnostic of this clinical condition called asthma, there has been groundbreaking evidences has been found between the connection of asthma along with gastroesophageal reflux disease. So, first of all, initially, I want to explain in briefly that what is an asthma and what is a gastroesophageal reflux disease, and then I will be bridging the gap between the two in order to enable us that how a gastroesophageal reflux disease, which is connected with the GI system, can be connected with the worsening of symptoms of asthma. So, asthma is a condition in which the airways in the lungs becomes narrower, which causes its difficulty in breathing, and which can be caused by various factors including like allergens or things which irritates the airways, which resulting in the excess of secretion, as well as the bronchoconstriction resulting in the narrowing of the airway passage, which causes the chronic cough, as well as sometimes wheezing, whistling sounds, as well as difficulty in breathing. Whereas on the other hand, gastroesophageal reflux disease is a condition which is connected with a different organ system, that is the gastrointestinal system, which is associated with the reflux of the gastric content. Means normally when a person eats the food goes on the food pipe directly into the stomach. But in case of patients suffering from gastroesophageal reflux disease, what happens that due to incomplete emptying of the food contents of from the stomach to the lower intestine and so on, some of the gastric content goes up the tract and reaches the esophagus, thus irritating it and finally coming in the mouth. And often patients suffering from a chest heartburn, as well as feeling of acidic taste in their mouth and so on. So that is about gastroesophageal reflux disease. So GERD can worse. Now I'm bridging the gap between that how these two can result how gastroesophageal reflux disease can result in the worsening of symptoms of asthma. So it has been found that more than half of the people with asthma also have an underlying gastroesophageal reflux disease, whether it is symptomatic or as asymptomatic. What does it mean asymptomatic? That is, the patient may have this reflux diseases, but the patient doesn't pay much attention to the fact that they are having this reflux disease, and in that case, they become asymptomatic. Means they are having it, but not having a clear-cut symptoms like heartburn or feeling of an acidic sensation in in their mouth and so on, and hence they does not make such complaints. But the only thing which they complain is about chronic cough, especially worsening at night, feeling of chest tightness, and whistling sounds coming during the time of breathing. So gastroesophageal reflux disease can worsen the symptoms of asthma and is more common in people with asthma compared to those without it. People with difficult to treat asthma are more likely to also have gastroesophageal reflux disease. So, as we said, that what happens in a gastroesophageal reflux disease is that the gastric contains leaks into the esophagus. So, uh, the tube which carries the food and the liquid, uh, so the acid irritates the nerve in the esophagus, sending signals to the brain. In response, the brain sends the message to the lungs, which leads to the tightening of the muscles and the formation of mucus. This makes the airway in the lungs narrow, leading to the asthmatic symptoms. Sometimes contains from the stomach, like food, as well as some acid, can directly go into the lung, and which is known as aspiration, and in worst case scenarios can result in aspiration type of pneumonia. This contains from the stomach irritates the airways, leading to wheezing, coughing, chest tightness, and other symptoms which are associated with asthma. Asthma related to GERD can happen to anybody, including babies, children, as well as teenagers, and even in case of obese, and especially in obese patients. Certain people may have GERD symptoms sometimes, while others may have them all the time. Symptoms can also happen after eating certain food, or in cases if they're allergic to certain food items, or or inhalation of certain items in which they're allergic to. When symptoms of asthma caused no when to understand that whether these asthmatic symptoms can be caused because of an underlying gastroesophageal reflux disease or not. There are certain things which we need to pay attention to in order to understand that if the patient is having this asthmatic symptoms, there may be an underlying gastroesophageal reflux disease is associated as well if we find any of the following symptoms. So the symptoms happening especially after taking a big meal. The asthma gets worse at night while you are sleeping. The asthma worsens in the middle age, and the symptoms are not related to any kind of allergies or any kind of infections or any kind of uh, food materials or anything in the atmosphere which can result in the development of these symptoms. Your voice may often sound harsh, rough, or choked, or even sometimes can be strained. And you experience frequent bouts of coughing without any kind of expectoration of sputum. And your asthma may not improve with the standardized recommended asthmatic medications. So now it's very important to understand that what we should do in order to control the symptoms of asthma, because previously we were uh, we were recommended that we should only recommend asthmatic medications, but however the recommendation of these asthmatic medications doesn't improve the symptoms of the patients as much as it should do, because there is an underlying different cause. So therefore it is very essential that we must perform certain do's and don'ts in order to reduce down the frequency of these asthmatic attacks, and also to treat the underlying factor which may be associated and may be the causative factor which is resulting in the triggering of the asthmatic attacks. So, certain do's and don'ts are that is, we must recommend such patients having eat smaller meals more often throughout the day. Limit the food and the drinks like citrus fruits, tomatoes, spicy foods, caffeine, colas, fatty foods, chocolates, peppermints, and while sleeping to raise their head at a minimum level of around 6 to 8 inches from the bed, and or maybe lying on a simple, slim, thin pillow. Maintain a healthy weight, relax, and to manage stress. Take medications for asthma regularly as prescribed, and avoid asthma triggers as much as possible. To wear masks in case of going into a dusty environment, to be cautious of uh, not to handle with any sort of dust or something which is at home without giving proper protections to the nasal airways, and also to be especially careful about the food which may trigger an asthmatic attacks. So avoid eating 2 to 3 hours before going to bed. Do not wear tight belts or clothing around your waist, and avoid smoking in case of those people who are smokers. When asthma and acid reflux happens together, medicines for asthma might not work as I mentioned before for some patients. But in that case, the treating the acid reflux can help the improvement of the symptoms, because we know that, as I mentioned earlier, that when I was bridging the gap between gastroesophageal reflux disease as well as asthma, I mentioned that the GERD, or the gastroesophageal reflux disease, can be the cause of the triggering of the asthmatic attacks. So it means that only taking the medications for asthma, definitely we are reducing down the triggers for asthma. But one of the cause which can be resulting in the triggers is the gastroesophageal reflux disease. So in that case, the attacks may be reduced to some extent, but may not be fully gone, and may be triggered from time to time. So in order to achieve complete remission of these asthmatic attacks, it's also essential that we must control the underlying causative factor, that is the gastroesophageal reflux disease. And often it has been seen that treatment of this gastroesophageal reflux disease can itself help in the improvement of the symptoms of asthma. If you have asthma and you think that you may have asthmatic acid reflux, I would suggest you to immediately talk with the doctors about the best associated treatment, because for an acid reflux treatment, we have gastroesophageal reflux diseases. We have many medications, which includes PPIs, as well as over-the-counters antacids, as well as the new RAF formations, which helps in the not only the neutralizing of the acidic contents of the stomach, but also prevents the reflux of it. And at the same time, to continue with the asthmatic medications. There are certain asthmatic medications like theophylline, which can make worse acid reflux worse. So such kind of medications should be avoided in case if one is sure that an acidic reflux could be the cause of such repeated triggering attacks of asthma. But it is advisable not to stop or change any asthmatic medication without consultation with your physician. The physician should be the best judge who should decide that what could be the causative factor for the asthmatic attacks, and additionally what extra could be done in order to reduce the uh, development of such recurrent asthmatic attack. And also it is very much essential that gastroesophageal reflux disease, also we don't pay much attention to it in association with bronchial asthma, but it is absolutely essential that we as physicians must also pay additional attention to gastroesophageal reflux disease and the treatment of the gastroesophageal reflux disease, as well in preventing the triggers of such asthmatic attack for our patients, for the betterment of their life, and to reduce down the number of triggers of such asthmatic attacks, because often asthmatic attacks can be very much troublesome for patients, because it's often dry cough, especially irritating the upper respiratory tract, disturb sleep at night, and also sometimes can be worsened to severe respiratory distress and needs maybe hospitalization and so on.